a lot of these essential services, but a proper scheme has not really been put into place. And in the initial bill, we really were trying to just stipulate, even to the point of being able to define how these need to work. But we've also realized that there's a lot of variation from one county to the other. So the provision to guide, the provision to move forward has now been taken as a responsibility at the national level, at the county level, the CEC being responsible, and also at the national level, the CS also being critical for this specific process. Madam Speaker, I just want to give specific examples from various countries to show how important this is. The whole idea of ensuring that the workforce is taken into consideration and that they're able to do what they're expected to do is very, very key. And I want to just go to the case of Indonesia, for example, that restructured its health system in 1982 to focus on district health development. And as a result of that, as a result of involving the local community, the activities at that time included family planning, health education, immunization, treatment, etc. And according to the WHO report, it led to a significant health status achievement. Infant mortality dropped by 30% within 7 years, and immunization coverage improved significantly. Closer home, we have the county of Isiolo that has done very well. They have been in partnership with the Living Goods, which is a non-profit organization, for the delivery of cost-effective integrated community health services within the county. And according to a particular report, that is the Living Goods Community Health Impact Report 2020, the proportion of women who attended the recommended number of antenatal clinics increased. And we've had more and more of cases in Isiolo where women are able to get to the delivery centers faster than they were able to before, that the outcomes for these children. Madam Speaker, the work of community health volunteers within the community is so important. We're actually talking about the health of the nation right from the beginning. We're talking about child mortality, we're talking about immunization, we're talking about maternal health, we're talking about nutrition, we're talking about basically everything under health matters, and that these are stipulated and advanced and discussed at the early levels so that these are taken into consideration right through the various moments and the various times that are very, very critical. So through the various declarations that have been given at the international level, the role of community health care workers has always been attributed, it has always been affirmed, it has always been seen to be something very, very critical. And this is what we're trying to achieve, Madam Speaker, putting it into perspective and being able to just find a way to be able to put into this place. Madam Speaker, I just want to give a few statistics just to contextualize where we are and where we need to move to. And this is according to the Kenya Health Workforce Report 2015. Right now, we have 15 doctors per 100 population ratio. Yet the WHO guidelines advocate for 36 to 10,000. Madam Speaker, I'm just giving this to highlight that already our healthcare system is heavily tilted towards service provision where the numbers are not really adequate. Just to say that at the end of the day, community health cares, community health volunteers and community health care workers are able to cover for this gap. That same report also showed 8.3 nurses existing per 10,000 population ratio. But the WHO guidelines advocate for 25 nurses to that same 10,000. So we are at a third, more or less. 27 clinical officers per 1,000 population ratio, and medical laboratory officers are standing at 10,000 population ratio. So this just highlights that it's very, very important to come up with a schemata or with a scheme that allows us to bridge between the community and the formal health services in the various sectors of health development, which are very, very critical, Madam Speaker. And through the various examples, Indonesia, Isiolo, all these just show that the delivery system is very, very key. And this particular filling in of this lacuna is carried by the strategy of community health 2014 to 2019, which speaks heavily of community health services and how these are very important in closing the gap for better health outcomes within communities in Kenya. And therefore, given the role, the structures becomes very, very important. This bill also hopes to provide a uniform minimum standard upon which county health services may be achieved. Madam Speaker, I just gave the example of Isiolo, but we have so many other counties, and we find that variation mainly because there's no specific guidance in terms of how the CCM should operate within the counties, how the county assembly should be envisaged to come in, and how the various structures should be put into place. Madam Speaker, therefore, the clauses in this particular bill seek to address this. We start by giving the role of the national government, what those expectations are, the role of the county governments, the importance of health officers, the delivery of health services, and how this should be enshrined. The Community Health Committee, which is a committee constituting key members within the community who can discuss the various outcomes for that particular county. The appointment of community health volunteers, Madam Speaker, the need for a register so that we have members, even though they are community, even as they are community healthcare volunteers, they are well entrenched. Their role is understood. The register actually triggers down up to the ward level. The functions of the health volunteers is put into place. The registry, I've mentioned that. The inspection of the register, which is very, very critical, so that you have these influencers who are going around as key people who are known to do that. And indeed, Madam Speaker, even at the public barazas, these people standing up and being recognized. These are the people who have the mandate to talk about these specific issues. And then information on community health services and how this should be disseminated. Madam Speaker, this bill moves to encourage county legislation in this area. It also gives procedure standards, ethic guidelines, regulations, and also the need to pass reports to the county assembly members so these are properly taken into place. Madam Speaker, allow me just to highlight some specific clauses I think that are very, very key, starting with clause 3, where the objects of this bill are stipulated, which is to provide a framework for effective delivery for integrated, comprehensive, and quality community healthcare services, enhance community access to basic health services, entrench the role of community health care volunteers, provide framework for conferment of community health workers force. So because these areas are missing in terms of legislation, that objective or that object for this particular legislative proposal puts into place specific areas that will allow some sort of mechanism to be put into place. Then clause 5 tackles the importance of the national government, because we know health has been devolved to the counties. There are certain key prospective aspects also the national government plays, for example, in technical resources and structures, in terms of the qualifications of persons eligible to serve within the community healthcare workforce, and these have to be designated at the national level. Talking about technical assistance, for example, to county governments, that has to come from the national government. The county governments have also been given very key specific roles, for example, mobilizing resources that are necessary for delivery of healthcare services in the respective counties. And we had the governors speak to this and saying that we have resources at the county level that are already stretched out, but we have community health volunteers who have already been working at this over both the last phase of devolution and this phase of devolution. I think it's really just a question of putting things together so that we come up with a template that can be applied within the various counties, and this is what this legislation endeavors to do. Talking about adequate funds that are very, very key, putting in place mechanism to facilitate access to timely community healthcare services, facilitating access to information regarding appropriate behavior, including basic information on sanitation, hygiene. All these are very, very critical, and it is the community health services providers who move from one place to another to put this into place. Madam Speaker, at clause 6, we have very specific provision at county level, but that touch on the CEC member. And this is, for example, to advise the governor on all matters relating to delivery of healthcare services. So these are properly entrenched, building capacity within the counties, monitoring and evaluating the effectiveness of community healthcare programs so that they can know, are they improving, are they reaching out to the people that they're meant to reach out to. So that clause, and there are very many specific sub-clauses, gives the meat, the teeth that is needed by the CECM to be able to cascade this higher up into the county and discuss this at the level of the county governor. We also have at sub-clause 3 the introduction of ensuring that the county executive member, in order for them to effectively perform the functions, can delegate the performance of such functions to the Director of Health. So it introduces a Director of Health who can be very specifically targeting the issues of health, so that in case the CEC also has other issues that they're tackling, that the County Director of Health specifically delves into this. Clause 7 deals with the health officer and the roles of that officer. It gives these in details, including overseeing the selection of community health volunteers, providing technical support and training. At clause 8, we have the Director of Health's responsibilities, again further outlined in detail. The role of coordination becoming very, very critical and important, because we define in this bill the community that is going to be assigned by the CEC in terms of how the CEC can capture the various communities and be able to give these services. So we don't have a general definition of a community. We have a community that will be defined in terms of logistics, that this particular numbers of community health volunteers, for example, work in this particular area. So the Director of Health is very critical to make sure this is together. Madam Speaker, when the community health volunteer goes to do the work, they go out with a kit, they go out with a notebook, they keep recording, they keep needing to give back this feedback back to the mainstream to give all these explanations. And therefore, it's very critical for that coordination to be very, very key. Clause 9 deals with the Community Health Committee and its membership. Representing a woman, representing women groups, a person representing PWDs, a representative of the youth, a ward public health officer, so that all the matters of the county that are touching on health can be discussed at a particular point. And then, Madam Speaker, very critical at clause 11, the community health officer and the functions of that health officer have also been put out very clearly at the ward level. The reference is also made to specific that. At clause 9, are very important, and sub-clause 5 and 6, each county government may enact county-specific legislation setting out the procedure for the nomination and election of the members of the committee, the terms of appointments for these members, and criteria for these nominations. So the role now for managing health matters at the county level is also given as a responsibility to county assemblies that can come with this sort of legislation that they'll be able to perpetrate even further. And then clause 10 deals with the community health volunteer and the process for selection for that particular volunteer. Clause 11 is very, very extensive. It now gives the CHV's responsibilities that are very, very broad, and I've mentioned them as I was continuing to move this bill. And at clause 12, we have each county director of health shall maintain the register, and I've spoken to that, Madam Speaker, that this will go down to the ward level. So the CEC at the end of it, especially under miscellaneous provisions, will report to the county assembly what is happening. So we have a link that is created throughout the whole system. And clause 17 introduces the cabinet secretary as being very key in terms of consultation with the council of governors, making regulations, prescribing standards and guidelines, generally for the better carrying in effect of this particular act, Madam Speaker. And then we have at 18, the government will also, over time, enact county-specific legislation generally for the better carrying out of this. Madam Speaker, given the outcome in terms of community health work at the community level from counties like Isiolo, from Indonesia, and from so many other countries that were able even to surmount some of the bigger problems that came later on, it means that this is something that needed to be done even earlier. And I think if we had a better system for community health services within the counties, even the whole issue of COVID might have been handled. We would have had the basic structure to be able to handle it probably better and be able to reach the various communities. Madam Speaker, this bill is very, very critical at this time for Kenya. So I really hope that we'll be able to support it, that you'll be able to push this agenda and have it legislated on, and that this is very, very key. Madam Speaker, as I conclude, I'd like to acknowledge the presence of a young, dynamic lady called Caroline Cherop. In terms of the role she has played in coming up and really having a discussion and all the time being able to be involved in the process of looking at various issues that come and how to really just push these issues out. As she moves on to other responsibilities, I just want to acknowledge publicly that the role she has played within the various issues and duties that she has had, she's performed in an exemplary way. Madam Speaker, I just want to leave it at that and really just hope that we can push this to the next agenda. And now that the community, the health committee already made recommendations, I'd mentioned that this have already been infused in this bill. So maybe even as it goes to the committee, you can't stop new issues coming up during public participation, but just to mention that we've taken up what had come earlier. Madam Speaker, with this, I beg to move and request Professor Ongeri to second. Thank you.
Senator Professor Sam Ongeri.
Thank you, Madam Speaker. Indeed, I have the pleasure in seconding this bill, the Community Health Services Bill. One of the most important elements in this bill is the element of decentralization of health facilities to the village level. And therefore, no wonder in the preamble of this bill, there is the element of villages as the county executive may from time to time determine, depending upon the nature and the requirement of the health facilities that are required at that village level. Hitherto, there's been a lot of difficulties in accessing the health facilities at the community level. Even if the level 1 hospitals and health centers are within a given locality, the distances between that level 1 facility and the villages that are dotted around that level 1 facility may be the limiting factor in the delivery of health services. And I know as a medical professional that it's not possible to be able to put trained doctors in every village. And therefore you need what you call an army of health workers who are properly trained, who are properly skilled, and who are properly motivated to be able to perform certain tasks that are important to deliver the health package to that community. And therefore, this is indeed the most cardinal point. Even from independence, one of the things that we fought for and we strive to achieve is to achieve the level of education, to achieve the level of social development, and to achieve the level of health within our community. And therefore, this community health bill is not misplaced. It's fulfilling those tenets and fulfilling those aspirations that were captured in our constitution. Accessibility or access to services, goods and services, health being one of those goods and services that must be accessed at the community level. So I'm quite happy that this element of community health services Not only does it take into account the county government, but it's also in collaboration with the national government because of overarching policies that touch from one county to another and are coordinated at the national level. And therefore, later on in the structure of this community health bill, there will be cooperation between the national government and the county government. And at the county government, the county executive and the community level will be able to coordinate how these health services must be delivered to be able to touch the very primary healthcare systems that are required at the village level. What are these services that are required at the village level? We have the maternal and child health services that are required at the village level. Under the maternal and child health services, you have the nutritional services that are required in that village level. We used to have the traditional birth attendants. One of the biggest mortality in birth, in deliveries, is the maternal mortality rates, which are fairly high because our mothers have not been given access to information, health education, and how to be able to rear and bring up a child who is inborn. And how to be able to rear and bring up.
Unataka nikutumie link?
Nishachukua.
Ngojea kwanza.
Ndio.
Nataka to stop this live stream.
Niko nayo.
Just delete it.
Wallahi.
Ndio niweke ya at least almost real time streaming, because currently we aren't like streaming on real time. Kuna delay. So let me just set this let me just end this live stream so that we can start